Afternoon, everyone. This is Corey Portner, lead PIO here at the Joint Information Center for Washington State's COVID-19 response. Today is Thursday, April 9th, and we have our COVID-19 update. Today, we welcome Healthcare Technical Fellow, Dr. Justin Sanchez from the Battelle Memorial Institute. Dr. Sanchez will be discussing and answering questions related to the Battelle Critical Care Decontamination System for PPE. Dr. Sanchez.
Thank you so much for that introduction. To give you a little bit of a background on the system that we have, when the COVID-19 pandemic was just starting to make its way across the globe, we started recognizing that there was going to be a severe shortage of personal protective equipment. And for those of you who don't know a lot about Battelle, Battelle's a 90-year-old company that's working in health and national security, and we have a lot of talented scientists that work in a lot of different areas. And there was this one particular scientist, his name is Kevin Homema. His wife is actually a medical professional, and she came to him and said, "Look, there's this pandemic that is happening. There's very likely to be a shortage of personal protective equipment." And Kevin came back and said, "Well, we have a technology we had proven out a number of years ago that can be used for decontaminating equipment. And this technology is based upon vaporized hydrogen peroxide. And we wrote a number of scientific papers on that and showed with a significant amount of data and confidence that this approach actually worked. Kevin brought this idea to the leadership at Battelle and said, "Look, we're going to have this problem and we think that we can solve it." The leadership at Battelle started mobilizing resources in order to put together a prototype system in order to show how this decontamination of personal protective equipment could actually work. And so to get into a little bit of that system, you may have seen some of it online, but they're basically shipping containers that have been designed such that you can load them full of N95 masks. And once those N95 masks are in there, they're vaporized systems that put hydrogen peroxide into the air, and that hydrogen peroxide will react with any, let's say, microorganisms or pathogens that might be on those masks, and them so that they don't cause harm to the wearer to others. We all have experience with hydrogen peroxide. You might have used that in your everyday life when you kind of put it on a cut in order to clean the cut. Same kind of idea here. The only major difference is that the concentration is a lot higher. So we're talking about 35% hydrogen peroxide vaporized in those masks, and you expose them to that vaporized hydrogen peroxide for a couple of hours, about 2.5 hours. And then once they're exposed for that period of time, you have to let them sit for a little while in order to what's called off gas. And then after they've been through that sterilization cycle and process, they can be repackaged and sent back to those hospital systems that had shipped them to us. And just a little bit more about that process. So all of you may know that hospitals traditionally, when their frontline workers use their masks, once they're done with them, they just put them away. We had to implement a whole new process of using those masks and sterilizing them. So essentially they get bagged up. There's kind of a double bagging process that you put the used masks into. They get shipped over to the decon system that's over at Camp Murray. And there'll be a team of professionals and experts, approximately 20 people, that can put those masks all through that process. And once they're done, they'll rebag them and they'll ship them back to those medical institutions. You can do this process about 20 times. That's what we have authorization to do from the FDA. And each one of the masks is marked for the number of times that they've been sterilized. So it's an end-to-end process that a lot of really talented people at Battelle have put together, and they've been working nonstop since the pandemic hit. And we've been doing everything that we can in order to deliver solutions back to those frontline workers so that they can be protected, carry out their mission in order to help those most in need. I see that there's a question here about the number of masks that can be decontaminated. 80,000 containers in a system is 4 shipping containers. Each one can hold 10,000 masks. You can run the system over 2 shifts. So that's how you get to 80,000 masks. And the cost for sterilizing each mask is $3.25. There are plans to deploy these systems all across the country. We are scaling production of these systems, and there are a number deployed. The one is here in Washington, but there are other systems that are deployed in New York City and also in Boston. There are questions regarding, can they only decontaminate masks, or can they decontaminate other types of equipment? So right now we just have the authorization to do these kinds of masks and 95 masks. We do believe that the system can be used for other types of equipment. So think of like ventilator parts and things like that. We do not have the regulatory approval to do that yet, but that might come down the pipeline a little bit later.
I wrote some questions here on the right, but I have a couple. Any plans for more containers? And if so, where do you think you'll send them? And then estimate on cost saved by doing this?
So in terms of the number of containers, we're working very closely with the federal government in order to serve the highest need locations across the country. We're in dialogue as we speak about where those next systems are going to go, but we absolutely have the goal and the mission to scale up the number of systems. We're ultimately trying to get to near 100 systems deployed across the country. We are trying to scale past this initial set of systems that have gone out. Our aim and our goal is to start out to do approximately 5 per week. Obviously, this is all very, very dependent upon supply chains, right? All of the necessary components and materials that would need to go inside of these systems. As you can imagine, we're living through extraordinary times right now, and those supply chains are extremely strained. Again, we're working closely with the federal government in order to solve some of those problems. We anticipate that the need for these systems is going to persist for some time. Obviously, having access to these kinds of masks is extremely important. There's a huge demand on the masks that are out there. So we're going to continue to do our work and serve in this mission in order to deliver these systems to those who need it the most.
All right. So we have another question here from the chat. Martha asks, how many masks can be put in at a time? And then for that run, I guess I'm inferring here, what's the cost associated with that?
So the number of masks is per run, a maximum of 40,000 masks. And then we can do 2 runs a day. That's how you get up to the 80,000 total that is quoted in the system specifications. And then the cost associated is cost per mask, $3.25 per mask, and then those are all tallied as that system runs along and as those hospital systems run them through the capability.
Another question here. Is the system here in Washington currently operational?
So, the system is in place. It's up and running. We're working very closely with the hospital, so Kaiser Northwest, in order to get the system and the integration, the logistics, all of that, so that it's at a point where it's working at full speed. As you can imagine, again, this approach to decontaminating masks is very different than the standard operating procedures in hospitals. So we are going through a little bit of starting that new process and getting everybody on the same page for how it actually unfolds.
Question here. What's the process for getting the contaminated masks to these systems like? Is that arranged?
Yeah, so we have a new logistics set of processes and procedures. Our teams that are deployed with the system are working very closely with the hospital, and that very detailed procedure specifies how those masks should be placed into the shipping bags and the shipping containers, and how they should be transported. And as you can imagine, these masks are they've been exposed potentially to people that have COVID-19. You have to go through a process such that you protect the safety of those people involved in that process. And we've taken every step in order to ensure that those protocols are in place.
Thank you. We also have another question from Kristen Ayers from King. First, how many Washington hospitals have expressed interest in using this technology?
We're working with just one hospital as of this time, but as you can imagine, we're in a very, very active and busy process of connecting with hospital systems all across the country. We have an extraordinary number of hospitals that are trying to engage with us. So, as we speak, our teams are engaging with other hospitals, not only in Washington, but also abroad, in order to try to put all the infrastructure in place in order to help those in greatest need.
Thank you. And I see that Kristen also has an additional question. For healthcare workers who remain skeptical that PPE can be safely recycled, what can give them confidence? What would be a response from Battelle on that?
Absolutely. So part of putting this process and this system together, we did a number of studies. Again, this was several years ago, in which we explored for other pathogens the effect of using vaporized hydrogen peroxide for decontamination. And we have scientific publications as well as data sets that show its effectiveness. In addition, we have taken this process and worked very closely to the regulators at the Food and Drug Administration, who have reviewed that process and have provided both feedback and authorization to use it in this way. In addition to all of those things, we also do checks of those masks that go through the system to ensure that they are free of pathogens. We have multiple layers of confirmation as well as safety protocols that are put in place in order to ensure that these systems work in the way that they're specified to work.
All right. And we also have another question here. How would you identify the masks coming in from each hospital? And I guess that kind of also connects to, you mentioned that the masks after they've been sterilized are marked.
Yeah, so they're marked in terms of the number of times that they've been sterilized. Each set of masks, they do have an identifier associated with them. All of those identifiers are logged into our systems. And that way we can connect the masks that came in from a particular hospital back to that hospital after that they've gone through this process.
So there's an additional question from Doug. If a health professional, has a contaminated mask, is there a conversation about where the mask would better be decontaminated versus thrown out? What's the conversation like that on that end?
Yeah, at this point in time, these masks that are used in this way for COVID-19, those hospitals can choose to send them for sterilization. The medical professionals will ultimately make that choice. The hospital system will ultimately make that choice on which mask they choose for sterilization, or if they choose to just to discard them. We're not making that choice along the way. That's up to the medical professional.
Question from Rich Smith. In comparison, do we know how many masks are used by healthcare providers in a day?
That's a terrific question, and it's likely dependent upon what the state of the hospital is, right, and which is going through this set of conditions. So obviously, a place like New York City, where they're seeing an exponential growth in the number of patients that are presenting with symptoms related to COVID-19, the throughput of masks that they're using is much higher than somewhere else in the country where those that demand is not as high, or that set of conditions is not as high. What's really interesting right now, there's kind of an ebb and flow as a pathogen and a pandemic makes its way through a country like ours. And what's really important is that you have capacity in order to to use those resources in order to decontaminate in the way that you need them the most. And that's what we're working for now, or working towards now, to try to get those systems to those places that need it most. And then also think about where are the other locations that might likely be hot spots moving out into the future. And that's why working very closely with the government is so important right now, so that we can make those decisions together.
So we near the top of the hour here. We have an additional question from the chat. Is this system able to work with all different kinds of N95s? Or is there a specific brand of respirator only?
So we do have specifications on the types of N95 masks, and we can share that with the team in terms of those specifications. But they're generally can be used for the most commonly used N95 masks that are in hospital systems all across the country.
We have a clarifying question. You mentioned that currently one hospital is being worked with. Can you repeat that, Dr. Sanchez?
Yeah, so it's Kaiser Northwestern is the hospital that we're working with right now.
And you did mention that currently, and this goes to a question from Doug, is there a limit to how many times a mask can be decontaminated? I believe you mentioned it was 20 times. Is that correct?
Yeah, 20 is the limit for the times that mask can be run through the decontamination system. And that's where the marking of the mask, so that we know how many times that they've been through, will help to indicate what that number is.
Excellent. Well, that takes us within 5 minutes of the top of the hour. I would like to thank you for joining us and presenting on this topic. We really appreciate you taking the time, Dr. Sanchez. And for our folks that tuned in, if you have any follow-up questions, please feel free to direct those to logic@mil.law.gov, and we will go ahead and close out the meeting today. Thank you so much.